Dr. Daniel Schacter.
There we go.
Awesome. Let me ask you this question because actually my brother recently became a doctor. What does that feel like, or as in gain the title of a doctor? What does it feel like in having that associated with your name now compared to not having it however many years ago?
Yeah, doctor in my case is a reflection of having a PhD. I'm not an MD and I'm not a medical doctor.
Hmm.
And so it's just a mark that you've, had a high level of training in your field and you did enough work as a graduate student to produce a PhD dissertation and receive a PhD. So
Mm.
it's a mark of some achievement and some level of expertise in your field.
Does it carry a lot of significance for you?
It's kind of in the background because I've been a PhD for a long time, and it's just the it's kind of like the card that gets you in the door in my field in order to be able to do research and uh, teaching at a research university such as Harvard, where I am. So it's kind of in the background, but a necessary condition of doing work in my field.
Mm. I've often been curious about it because I know people who have it and people that don't. So for me, the question as someone who doesn't have it yet, maybe that's a better term, is to just try and understand how do people perceive it from different experiences, different lenses. I know
Hmm.
some people who have it and they're like, it's just something I put in my email signature. And for some, it's a very prevalent and prominent thing that they use. So wasn't wasn't sure, and I figured, hey, while I have the opportunity, why not ask the question, right?
Yeah, why not?
I love your research. I love what I've been able to come across, and as I mentioned to you, of us having a podcast prior to a podcast, if we didn't hit record, was this whole concept of memory and how it can be used as a tool to help process elements of the past, help create the future. I wanted to have this conversation with you and not entirely sure where to begin, but maybe begin with the topic that you and I first discussed, and that's memory being used as a tool, as a way to process different things. What piqued your interest to begin with? What got you thinking, hey, this is a topic that I would want to study for X number of years, maybe the rest of your life? I don't know if you've committed to that topic for that
I'm
long.
I'm pretty well down the road, so I think I made the commitment.
But what got you interested in initially?
That's a very good question. In when I was an undergraduate at the University of North Carolina at Chapel Hill, I was always interested in psychology. Initially, primarily clinical psychology, but my interest shifted toward the end of my undergraduate career toward more experimental psychology. And shortly before graduation, I was assisting some researchers over at Duke University doing some interesting work, not on memory, but on like altered states of consciousness and some related topics. And they put me in touch with a psychologist at Duke and the nearby Durham VA hospital by the name of Herbert Krovitz, who had worked on perception and memory and was looking for a research assistant. And so I had a meeting with him. We hit it off, and he hired me to be his research assistant. This is all the way back in the summer of 1974. I worked for him for 2 years, and he was starting to uh, test patients at the Veterans Administration Hospital who were older patients who had various forms of brain damage, and in some cases, brain damage or related conditions produced memory deficits.
Mm.
And as his research assistant, I was the individual who did the initial testing and assessment of these folks. And what really piqued my interest was in a number of these cases, the patients were unable to perform even simple memory tasks So if showed them a list of words or a bunch of pictures and you distracted them for just a couple of minutes, they would have little or no memory of what you had just shown them.
Mm.
And even more strikingly, if, for example, I was testing a patient for an hour and then had to leave the room briefly and came back, in the most severe cases, they would have no idea who I was. They would have no memory of the fact that we had just been working together for an hour or two. And yet, these same individuals performed well on, for example, general IQ test and test of intelligence that didn't tap their ability to remember their recent experiences. Their language production was fine. Their ability to perceive, visually or otherwise was fine. It was really a deficit primarily confined to memory. Um, Recent memory, or what we would call now episodic memory, our memory for specific episodes in our personal past. So that really piqued my interest. I decided to go on to graduate school focusing on memory. And at the time, in the mid to late 70s, kind of the International Center for Memory Research was at the University of Toronto in Canada, where they had a collection of really eminent memory researchers. I applied there, was fortunate to get in, and I work with one of those prominent researchers, Endel Tulving, a very influential figure in our field who sadly just passed away a little over a year ago. And at that time, was already a very prominent cognitive psychologist. And I realized that while I had this experience working with these memory disordered patients, I didn't know much about the basic psychology of memory. So I went to Toronto with the idea of learning that basic cognitive psychology of memory, learning, the skills to do experiments in memory research with the idea of, at a later time, applying those knowledge and skills to the study of patients with memory disorders. And so I worked primarily on normal memory during those years. I did do some related work on with patients with memory disorders. And then after I got my PhD in 1981, we were fortunate to obtain funding to set up a unit for memory disorders at the University of Toronto, which I was the director. And we sort of combined our methods and theories from the cognitive psychology of memory to studying patients with various neuropsychological memory deficits. So that's really how I
That's
got started
fascinating.
in the field.
In studying the different individuals with, I'm assuming, different levels of memory and experiences, what have you learned or what have you concluded as far as what is even the primary use of memory?
Yeah, that's a good question, and that's a general issue that I've focused on uh, for much of my career. And I think one of the main lessons that was becoming accepted back when I first got in the field, and then people have worked on more intensively recently, is the idea that memory is not just some sort of passive recording of external experience.
Mm-hmm.
It's a much more constructive act in which, when we remember a past experience, we're not just replaying a tape, we are remembering elements of what actually happened. We're combining that with our general knowledge of of events and how events normally unfold, and we're putting those things together to construct a memory of our past experience that may be very much influenced by our current knowledge and beliefs. And so this was a theme that was first sounded actually almost a century ago by the British psychologist Sir Frederick Bartlett, wrote a very important book called Remembering back in 1932, and it was kind of ignored for decades. Then became recognized in the field. And what I have tried to do is put together some of this constructive psychological view of memory with cognitive neuroscience approaches to studying memory. So part of that has been through the study of patients with specific kinds of brain damage that produce memory disorders. And part of that has been through the use of neuroimaging techniques, where over the last 30 years or so, we've been able to scan people through techniques such as functional magnetic resonance imaging, or functional MRI, fMRI for short, where we can scan people and we can look at what's going on in the brain when people remember past experiences and code new experiences, and perform a whole variety of memory tasks. So for me, kind of a driving theme has been what we might think of as the cognitive neuroscience of constructive memory, trying to look at how the brain constructs past experiences and exactly, what's going on in particular parts of the brain when we engage in these constructive activities. And one of the main themes that I've been working on is the idea that even though memory is subject to various kinds of forgetting and distortion, and these seeming flaws in memory can have important consequences in everyday life, resulting from annoying minor incidents of forgetting to very consequential memory errors. For example, when an individual misidentifies a person as a perpetrator of a crime when that person actually was not involved. Eyewitness misidentification can have very profound legal consequences. So there's a whole range of memory errors. But despite the fact that they can have these consequences, negative consequences in everyday life, one of the themes that we've worked on is the idea that these errors are not just reflecting flaws in memory. They're actually kind of prices we pay for features of memory that actually help it to work very well and in a highly adaptive manner.
How so?
Well, let me give a few examples. A book that I wrote initially in 2001, and I updated in 2021, is called The 7 Sins of Memory. And in this book, I break down memory errors into 7 fundamental categories: several different kinds of forgetting, several different kinds of distortion, and one particular kind of memory sin that I'll focus on now, because I think it makes it easy to see what I'm talking about when I make the point that some seeming flaws of memory are actually reflect adaptive features. And this is actually the 7th of my 7 sins, which I call persistence. And persistence refers to the fact that when we have an upsetting or even a traumatic experience, this experience can persist in memory in a way that has very negative and upsetting consequences. We experience a difficult event or a trauma, and that memory kind of takes over our minds. We can't get it out of our mind. We have intrusive recollections that can actually ultimately be associated in the most severe cases with post-traumatic stress disorder. So this persistence of emotionally arousing negative memories can have negative psychological consequences. So at first you would say, yeah, that's really an unfortunate feature of memory. But the other side of that is that we want a memory system that is going to preserve experiences, give high priority to experiences, that might threaten our survival, as upsetting as they are. We need to remember vividly experiences in which there might be a threat that could ultimately danger, cost us our lives. So that, I think, that memory sin, you can really see very easily the potential adaptive value. Now, I can apply that same logic I did apply that same logic in the book to all 7, but won't go through all 7, but I'll talk about one other that relates more closely to work we've actually done in my lab over the last couple of decades. And that's what I call misattribution. So misattribution is a kind of memory distortion when we remember some aspect of an event correctly, but we misattribute the source of the event. It would be, for example, we find out a really interesting new fact and we tell someone about it and we say, oh, my good friend told me this the other day, when in reality we actually heard it on the radio, for example.
Read it in a book.
Read it in a book. We get the source wrong. So that would be a misattribution error. And there are a few different reasons why these misattribution errors can occur. One has to do with the concept of what we might call semantic gist, that the memory system is set up so that we take away, the important meanings from experiences, sometimes at the expense of highly specific details. There's a nice experimental paradigm that some people might already be familiar with because it's fairly well known nowadays in psychology. It's called the Diess-Roediger-McDermott, or DRM paradigm. This is something that was initially discovered by the psychologist James Diess back in 1959, and it was kind of revived and modified by Roediger and McDermott to memory researchers in 1995. And it's been used as a technique to induce a particular kind of misattribution error or false memory. It's easily demonstrated. Suppose I read you a list of words, related words, such as candy, sour, sugar, bitter, good, taste, tooth, nice, honey, soda, chocolate, heart, cake, eat, pie. There's a list of 15 words, and I can test your memory for them in various ways. I could ask you
Please
just
don't.
I'll say hypothetically, I could just ask you to recall the words that I just said, as many as you can. That's called a free recall test. Or I could give you a recognition test. And I could say, for example, was the word candy on the list?
Yes.
You probably remember that. Was the word point on the list?
Probably not.
No, probably not. Was the word sweet on the list?
Maybe.
Maybe. Well, that's the one that for many people produces a misattribution error, a false memory. So you were willing to go to maybe, but for many people, they will swear up and down that sweet was on the list because it's related in meaning to all the words I said: candy, sour, sugar, bitter, etc. They all converge on sweet. And so the reason why you said maybe, and some people will say absolutely it was on the list, is that sometimes what we're remembering from the experience is not every single word, for example, that I said, but the general gist of what I said. So that could be one reason why, or is one reason why, certain kinds of misattribution errors occur, because we're remembering the semantics, the meaning of the experience, rather than all the specific details. And we've done neuroimaging studies where we looked at what's going on in the brain when people, remember the words that were actually on the list versus falsely remember these lure words that were related but were not on the list. And one of the interesting conclusions is that a part of the brain, it's called the anterior temporal lobe. It's the front of the temporal lobe of the brain. It has, in a lot of different research with patients and brain scanning, been implicated in processing and storing meaning, in semantic processing. It's an important semantic hub of the brain, many researchers will argue. And when there's damage to that part of the brain, a condition can result that's known as semantic dementia, where a person loses their sense of meaning of words and concepts. Well, that region of the brain has been implicated as a possible source of false memories in this DRM paradigm. When you are remembering a word list and you falsely remember a word like sweet, that has been linked to activity in the anterior temporal lobe. And so that makes the point that here's a part of the brain that's doing really important work for us, important cognitive work. If it's damaged, we're in trouble. And yet it's been implicated in this misattribution, false recognition memory error. So that's one example. But that's not the only reason why, or the only part of this kind of adaptive take on false memories as to why some of our memory errors or misattributions are reflecting positive features of memory. Another has to do with the idea that our memories, particularly our episodic memories, our memory for our particular past experiences, are not that kind of memory is not only important for allowing us to travel back into the past, travel back in time, revisit our past experiences, reminisce about things that have happened to us, a very important function of memory, obviously, but not the only one. There's been mounting evidence over the last couple of decades that our episodic memories are also important for allowing us to imagine and simulate future events. That our episodic memory is not just important for remembering the past, but also thinking ahead to and imagining the future. And there are a few different kinds of evidence for this. We and others have done brain scanning studies, for example, where when you put people in the scanner, you give them a cue word and you ask them to remember a related past experience, let's say from the past few years. So I could give you a cue word such as beach, and I say, try to remember an experience from the past few years related to beach. And you probably think of a vacation you took or a nice summer day, something along those lines. But I can also do the same thing and ask you to imagine into the future. So, an example with a different cue word. I could give you a cue word such as dog. Imagine an experience that could plausibly occur to you involving a dog in the next few years. You might say, oh, well, I might go to a pet shop and pick out a nice puppy, and you could elaborate on how that might happen to you. And when we put people in the scanner and we have them do those tasks with a bunch of cues for each task, remembering the past, imagining the future, and we look at brain activity compared to some control tasks where they have to engage in various kinds of cognitive processing, but they don't have to remember or imagine specific episodes, what we find is that there's striking similarity in the brain regions that show increased activity when you remember the past and imagine the future compared to the control task. The pictures look nearly identical.
Wow.
The brain images. They're not quite the same. There are some subtle differences, but the striking thing is that there's a whole network of brain regions that activates pretty similarly for remembering the past and imagining the future. So there's one source of evidence that those two things are really closely related. There's also evidence from amnesic patients with memory disorders that we talked about earlier. And in fact, some of the very earliest informal evidence for a link between remembering the past and imagining the future came from one of the patients that Endel Tulving and I studied at the University of Toronto. He was a young man, known in the literature by the initials KC, who had suffered a head injury that primarily damaged regions of the brain important for memory. So the hippocampus in the middle of the brain is very important for memory, a couple of other nearby regions. And because it was a head injury, there were some other parts of the brain were damaged as well. It wasn't just the hippocampus. Nonetheless, he maintained pretty good overall general cognitive function, but could not remember a single episode from his past. He would just say, "Oh, my mind is a blank." He knew general things about himself. He knew where he grew up, and he knew who his parents were. But if you asked him to remember a specific event, couldn't come up with anything. And so, in just an informal testing session where Tulving and I were doing various kinds of memory tests with him, Tulving asked him the question, "Tell me, what do you think about when you think about what you might do tomorrow?" And the striking thing was that this patient drew a blank in the same way that he drew a blank when he tried to remember what he did yesterday. If you pushed him, he would say, "Well, maybe I would have breakfast and then lunch." But he couldn't conjure up in his mind any specific episode.
That's fascinating.
In the future as well as in the past. And since that time, others have documented similar phenomena in other amnesic patients. So you put that together with some of the neuroimaging evidence, and again, suggest a very tight relationship between episodic remembering and episodic future thinking, or what we sometimes refer to as episodic simulation. The idea that you're using your past experiences to run simulations of a future event. Now that's a very adaptive thing, to be able to flexibly use your memory to take bits and pieces of your past experience, recombine them to help you plan for upcoming novel situations.
Mm-hmm.
So, for example, a common example we've all had some experience with, you're going to have a difficult conversation with a friend, and you want to figure out, well, how can I best navigate this difficult conversation we've got
Mm-hmm.
to have. So you might remember past experiences with that person. You might also remember similar situations with other people, and then you can take those different memories, recombine them, and run a simulation of how, taking a particular approach might play out with this particular individual. So you've got to really combine different kinds of memory and knowledge to do that. So it can be a very adaptive feature, but we also think that very flexibility of our episodic memories that allows us to recombine elements of past experiences to run simulations of future experiences can also be a source of memory errors.
Mm-hmm.
That sometimes, again, we miscombine elements of past experience. And this may be one we have argued and provided some evidence for, the idea that this may be one reason why we are subject to certain kinds of memory errors, where we confuse different elements of different episodes, and we fuse them into one single episode of an event that never happened, a false memory. That might be an expression of this very same adaptive ability that we can use productively when we try to imagine the future.
How often would you say, and I don't know if there's even a way to measure this or not, how often would you say an average person operates from either pure memory, as in exactly how it happened, with the source and everything else that had taken place, compared to false memories?
I mean, it's hard to say, hard to put a number on it.
Sure.
I think that for most people, memory is to a degree accurate more often than it's inaccurate.
Mm-hmm.
Okay? So, if we had a memory system that was consistently inaccurate, consistently producing false memories, we would be in a lot of trouble.
Yes.
So thankfully, we don't have such a memory system, and the output of memory, I'd say, is definitely accurate more often than it's not accurate. But whether it's accurate or not very much depends just on the conditions of encoding and retrieval.
Mm,
So, and how much time has passed between the two.
mm-hmm.
So, with more time, we're prone to more memory errors. Um,
Is that
if
because
we're
we're storing greater information, having to
Well,
remember more?
I think it's because we are we are subject to another one of the memory sins I talk about. I call transience, and that's referring to the fact that all other things being equal, and we know this from everyday experience as well as hundreds of lab studies.
Mm-hmm.
All other things being equal, it's harder to remember something that happened, a month ago than a day ago, and many other examples of that. That's been demonstrated many times in the lab. Again, all other things being equal. So I think that's one of the reasons that the transience of memory can factor into some of these misattribution errors. Be more likely to make these errors at some delay after an experience has occurred than, let's say, immediately, if the error is kind of a miscombining of different elements.
Mm-hmm.
So there are a number of factors that can play into whether or not memory is accurate. Certainly, memory can be very accurate. One of the lessons we've learned from eyewitness memory research that I alluded to earlier is that when memory is inaccurate and there is a false identification, incorrect identification of eyewitnesses, those can have devastating consequences.
Yes.
But we also know that a lot of those misidentifications, false identifications, come from suggestive questioning of eyewitnesses after
Mm-hmm.
an event has occurred. This is really something initially associated with the important work of Elizabeth Loftus back in the 1970s on what's known as the misinformation effect in psychology. And it's been demonstrated, many times. But what others have shown is that when these suggestive influences at the time of memory retrieval are not present, then there's a much better chance of an eyewitness's memory, being accurate. And one of the particularly dangerous things about inaccurate eyewitness identification is when an inaccurate identification is accompanied by high confidence. Person
Mm-hmm.
says that's absolutely,
Mm-hmm.
the individual who committed the crime, and it turns out that they're wrong. And there's been a lot of work on that recently. And what it suggests, again, consistent with what I just said, is that some of these high confidence memory misidentifications are the consequence of suggestive questioning, where someone maybe initially tentatively identifies a suspect in a lineup, and then they get feedback from an interviewer saying, "Oh, that's really good," or something to
Confirmation. Yeah.
confirmation that makes them feel more confident, and then eventually, what was initially a very hesitant, unsure identification, by the time you end up in court, the person is swearing up and down that that's the individual who committed the crime. So a lot of it depends on the exact conditions that obtain when we encode information, how long, how long a time has passed, and then at retrieval, the conditions of retrieval, whether we're um, uh, whether there's any suggestive questioning, either in an eyewitness context. This issue came up several decades ago in the controversy over false versus recovered memories of childhood sexual abuse,
Mm-hmm.
where some individuals, adult individuals, were claiming to have recovered long repressed memories of childhood sexual abuse. And while some of these memories under certain conditions can be accurate, I think it's very clear now in retrospect that many or possibly most of those memories, those recovered memories, could be inaccurate, and the consequence of suggestive questioning by
Mm-hmm.
therapists. Fortunately, I think there's a lot less of that going on nowadays than there was, let's say, 30 years ago. So we don't have a big false versus recovered memories controversy going on nowadays in the same way that we did back in the 1990s.
Wow. This is fascinating. I just out of respect for your time, because obviously you and I can have this conversation for hours upon hours and end.
Yeah.
Where can people learn more about the book? Where is it available? Do you have any additional research coming up that people can possibly engage in themselves?
Um, we always have research going on in my lab. It's Department of Psychology at Harvard University. If you've got any listeners nearby, we're always looking for volunteers. It's usually fun to participate in our experiments. We're particularly looking for older adults, somewhere between the age of 16 and 85, who are interested in doing brain scanning studies.
Mm,
In terms of the book, people are interested in following up on this, and a book that I wrote for the general reader, not for the expert. I alluded to earlier, The Seven Sins of Memory, and the best version of that, best edition of that to read is the updated edition in 2021's Seven Sins of Memory updated edition. It's available at Amazon, other online uh, sources of books, and that goes into more depth on the issues that we talked about and covers some of the points that we discussed.